We work with law enforcement, with corrections, and with hospital folks who have the job of trying to respond to people that are in mental health crisis and really have difficulty with it. There's really a problem communicating with sometimes with people who are experiencing a crisis. There's really a risk of violence and use of force to gain compliance, and so people need help getting through these events. So that they don't get hurt and the people they're responding to don't get hurt.
Across the country, there are no rules for how much training or what kind of training officers and other first responders need to have to de-escalate a crisis. Since the mid-1980s, increasing numbers of departments have put some officers through a special training program to learn how to defuse situations. These crisis intervention teams are often born out of deadly incidents.
The benefits of CIT training, if you're an officer, are invaluable. It's something that I use every single day as an officer.
For police, EMS, fire, nursing, anybody who comes in contact with consumers on a daily basis, and most people are going to have to admit, whether they know it or not, they're coming into contact every single day, whether they know it or not, with a consumer. It allows you to see these people differently, react to some of their needs a little bit differently.
Even if we're not responders ourselves, even if we're not mental health professionals ourselves, how can we help the person who's dealing with the crisis get to services or support them in their recovery?
The Barbara Schneider Foundation has been one of the preeminent organizations offering crisis intervention team training for many years. Now, all the training programs of the Barbara Schneider Foundation have been consolidated into the Mental Health Crisis Response Institute.
This training is based on the CIT model, Crisis Intervention Team Training, which is a national best practice, which involves a partnership between law enforcement, mental health, and mental health consumers. And so we provide CIT training. It's a 40-hour training for law enforcement. We also provide CIT for corrections and detention staff. And then we customize this training in a one-day session for people that work in a hospital, for social workers, for people out in the community, really for any group. It can be as small as 15. We think 30 is a good size, but it can also be a large group where we come in an auditorium and make a presentation for a day. We use actors to develop skills.
This is not something you call ahead and you may leave an appointment and I leave.
So it's not just understanding mental health crisis, it's learning the specific techniques. How do you de-escalate? How do you incorporate this in your practice, in your work, in your workplace?
There have been so many cases where I've had staff come to me and just thank me for bringing in this course to the hospital. I'd like to use the analogy of a farmer in his field. A farmer's going to plant a seed. And that seed is expected after a certain amount of time to produce this great crop. That's what Barbara Schneider brings to my nurses and my staff. They teach them to plant that seed to really help that mental health patient produce that great crop at the end, to get that health care that they need and to provide the services that we'd like to provide for all our patients, care, and family.
The Crisis Intervention Team model was developed by Major Sam Cochran for implementation by the Memphis Police Department in 1988. Sam Cochran recently appeared in a telecast seminar for the National Institute of Corrections.
The Crisis Intervention Team initially started as a first responder model, but it's a community program. It's not just a law enforcement program or a criminal justice program. It really involves the community as a whole. The other key important partnership is consumers. Now, I use that word within the context of consumers of mental health services. And actually what we're talking about is people who have a mental illness, individuals who are struggling and coping with illnesses. They too are part of this partnership.
Charles Jensen is an individual with a mental illness who appeared on the telecast to present the perspective of a consumer of mental health services.
They got it right. They got bipolar with psychotic features, and from the diagnosis comes the treatment. I got the meds I needed, and do you know what, folks? From '02 till now, I haven't seen a jail, and that's after 89 arrests and 7 felonies.
Charles is a board member of the Barbara Schneider Foundation and for many years has been helping the organization develop the range of training that is now offered by the Mental Health Crisis Response Institute. The Mental Health Crisis Response Institute brings all the Barbara Schneider Foundation training programs together to strengthen the overarching themes of our mission and goals by partnering with expert trainers and local agencies to provide de-escalation skills and strategies to professionals that encounter a person with mental illness who is in crisis.
We begin these trainings with videos that we produce. And what the videos do is they introduce the subject matter that will be discussed during the day. Both the problem, mental health crisis, introduce people to individuals who have had crises and talk about their recovery process, and introduce them to a variety of individuals that work in criminal justice, in healthcare, in mental health, and who are involved in crisis response and really are part of a collaborative network that can work together to improve the response to this population. People find this training to be actually pretty unique. It's based on the notion of learning concrete skills that you can take to the workplace to use to get through these situations. And the way we do this is we have actors who act out the crisis. And then we have a coach who's typically is a crisis responder, first responder, who is very familiar with the responses that are used and helps the class get through this interaction with the actor.
Randy Carroll is a lieutenant in the Sheriff's Department who works with the Mental Health Crisis Response Institute as a trainer facilitator.
The other students in their small group get an opportunity to give input and help them try new ideas, and they learn new concepts from some of the other people maybe with more experience in a learning environment that's positive.
I know. Cheryl, do you take any medicines on a regular basis?
It was very real. I thought the experience was very real. The actress was very real. It made you kind of think about when you're talking to them, kind of focus on what you're saying to them. She was very good. She was a very good actress. It made you feel like it was a real scenario that would really occur in our emergency department.
So there's a commotion going on. So
it's forcing me out of my comfort zone. Something I don't know that I really like volunteering for it, but I do know that's important to do something that is maybe a little uncomfortable.
We also bring in individuals who have been in mental health crisis, who have a severe mental illness, and who talk about the crisis that they went through and about their recovery process.
It was totally out of control. I was putting myself in dangerous situations all the time. I was being raped, I was being beat up, I was in dangerous situations constantly. So I knew I was going to die from the mania if I didn't die from the depression. I knew I needed to get this illness under control.
I have a mental illness, and it's bad enough I have this, but I'm willing to accept the fact that I have this mental illness. This is who I am. I can't change that, and you're not gonna change it either. I just need people to understand that I'm a human being too, and I deserve to be treated with the same respect as anybody else. God bless you.
We are trying to address the workplace violence issue in the city. And so it impacts our employees where they work. You know, some of the employees, what I would say, are on the front lines. And again, that impact is direct a lot of times. And so we need to do what we can to take care of our employees and provide the skills and the training to make our environment just a little bit safer.
Even though we're in a profession of heart and care, we all have our prejudices. And oftentimes, sadly, it's against those people who have mental health or are chemically dependent, and not for any malicious reasons, but they remind us to slow down and remember who we are, that we're people with problems too, and therefore we're reminded to take the time to have heart and compassion and get back to the root of why we are doing what we're doing, even for those patients who come in and may be a little bit more difficult than others. And for that, I can just say thank you with the deepest heart of my own compassion for Barbara Schneider.
It's an amazing, amazing training. It's going to be some of the tougher training that you've had emotionally. It is so realistic. It is not the type of training that a lot of police are used to. It's a type of training that will exercise your mind. It will exercise your conscience. It will exercise who you are as a compassionate human being.